For more on this story, we can go across to France 24's Mandakini Galot standing by in New Delhi. Mandakini, just how bad are things?
The situation is extremely alarming, Delano. The Indian healthcare system has not just collapsed, it is absolutely shattered at the moment. People across the country, in the large metro cities and in the smaller tier 2 cities, are unable to find hospital beds, unable to find oxygen, unable to find the drugs needed to manage infections, unable to find pretty much any access to healthcare. As you said, they're turning to social media. If you just go over Twitter or Facebook or Instagram, it's just full of people begging for oxygen, begging for hospital beds. But there are no hospital beds, and there is no oxygen, and there are no drugs. People are banding together, activists, lawyers, and others, to help each other. But noticeably absent from this process is the government. Even when they do try to help, like creating applications that tell people how many beds are available in which hospital, these are largely unreliable. So honestly, as a reporter, I've never witnessed anything like this. I was out on Monday at a new hospital that was set up overnight by the Indian military, and within hours of 250 beds becoming operational, it had reached capacity. And what we witnessed was people in distress, people with symptoms that are way beyond the point of being managed at home, being turned away from hospitals because there just isn't any space. The situation is the same at crematoriums and graveyards. They've run out of space. Bodies are lined up outside. Ambulances are waiting. It's overwhelming. It's really hard to describe what's going on, but it's unlike anything anyone imagined, and certainly unlike anything the Indian government prepared for.
Mandakini, the figures are stark. Over the past 24 hours, we have over 300,000 new cases reported, but the government is saying just 2,100 people have died in the past 24 hours. Do we believe those figures?
Look, there's absolutely no doubt that those figures are underrepresenting the mortality rate for sure. Now, whether that is due to incompetence or intent is a question that I cannot answer. But what I can tell you is, let's take the example of Delhi. In Delhi, in the last 3 days, we tallied the figures from all the crematoriums and burial grounds, and over 1,000 bodies were buried or burnt. While the Delhi state government says there have only been about 600 some deaths. Now, Delhi is the national capital, so even if it is underrepresenting, it's underrepresenting much less than some of the other cities that don't have that kind of spotlight. From Gujarat, certain cities in Gujarat, we're just hearing horror stories of bodies decomposing in mortuaries. From the neighboring district in Uttar Pradesh, barely 50 kilometers from Delhi, the crematorium there is burning bodies on the pavement because they don't have any space. But for a while, the district administration was only recording 2 deaths in all of April. So there is absolutely no doubt. Experts agree, epidemiologists agree that these figures are underrepresented. The mortality rate is likely much higher. How much higher? That's difficult for us to say right now.
Mandakini, the government says on the 1st of May, any adult that can get coronavirus inoculation. Will that likely happen? Does India have the vaccines necessary?
Yes, this is one of the measures that the Prime Minister announced day before yesterday when he addressed the nation. Now, the problem is that as of now, vaccinations are open to anyone who is 45 or above. But most vaccination centers in our cities, in our sort of rural areas, have run out of vaccines. So at this stage, it seems rather wishful to imagine that there will be enough vaccines for everyone by May 1st. Now, the second thing that the government has done is introduce a vaccination policy that experts are calling dysfunctional. Under this policy, private companies like the Serum Institute of India get to decide the price of these vaccines, and they've introduced different pricing for the state governments, different for the center, different for the private hospitals. What that means is, just imagine if in France there was a different price for vaccines in for the Parisian hospitals to buy vaccines and for provincial hospitals to buy vaccines. I mean, it raises questions about, are we a nation of states, or are these just independent federated states? So a really dysfunctional policy, and it's unlikely that there'll be enough vaccines for everyone by May 1st.
Mandakini, you did mention, I've mentioned that there's been a shortage of hospital beds as well as a shortage of oxygen in many parts of the country.
Absolutely. It's just heartbreaking. Now, late last night at around 8 o'clock in the night, a private hospital in Delhi moved the Delhi High Court, saying that they had only 3 hours of oxygen left. The court summoned the central government and admonished them in the harshest of terms, saying things like, hell is breaking loose. Do you care more about industry or human lives? Why are you so oblivious to ground reality? And this is the problem. The government, until yesterday, had not stopped steel plants from functioning to divert oxygen to hospitals. When, I mean, even now, hospitals in Delhi say they only have enough oxygen for the next 10 to 12 hours. So really a very dire situation as far as oxygen availability goes, and entirely the result of bad planning.
Mandakini Galot, thank you very much for that. Mandakini Galot reporting there from New Delhi.